Now I'd like to welcome Dr. Bob Gleeson up to the podium to give us our most recent COVID updates.
Thank you, President Todd. We're all getting tired of this. So most of the data, I have 10 slides, I'm going to be really fast, comes from yesterday's New York Times. Here's what cases look like in our state and Michigan. I put the arrow up there. I want you to look at that light orange line. That's hospitalizations. They have almost doubled. And that's why in Wisconsin our hospitals are quite full. Here's what's going on, same time frame, by the way. Here's what's going on in New York, Florida, Washington, New Jersey, etc. See that vertical line? We're headed there and we'll be there probably in about 10 days. This is largely, again, a problem of the unvaccinated. They're 13 times more likely to die as the fully vaccinated people. And vaccinated people are getting sick and going to the hospital. They're immune compromised. A lot of this is hitting over age 70. These are current hospitalizations by age. So you can see that increasing spike. We'll pay attention to that. This is Wisconsin data. Those are hospitalizations. The darker line at the bottom is those in the ICU. We currently have 450 people in the ICU in Wisconsin. Those numbers are going up. Our hospitals are overwhelmed. It's going to get worse. The current wave is both Omicron and Delta. The populations most at risk, the unvaccinated, the immune compromised, and the elderly, because they have a less good immune response to vaccines, less efficient, less effective. Omicron cases are likely to hit the millions per day in the US by mid-January. We have no idea how big this wave is going to be when it hits us. Even if Omicron is mild, and by the way, I'm not yet convinced it's mild in the unvaccinated. I don't have enough data yet. It's too soon in this pandemic to tell. Even if it's mild, we're still going to overwhelm the hospitals because a heck of a lot of people getting sick, it takes a relatively small percentage to go to the hospital and overwhelm them. And I worry that the case counts will be so high, we will overwhelm the healthcare system, our economic and governmental functions. I'm actually quite worried. And I've called myself Dr. Doom before. Just think of the airline cancellations. 2,700 airline flights were canceled yesterday because flight crews weren't there. So it's the same rules. Encourage vaccination and boosters. Wear a surgical, the blue surgical, or N95 or KF94 masks all the time. All the time. And avoid every place where there are crowds or poor ventilation. And by the way, I regard an outdoor Packer game as poorly ventilated. You're outdoors, but you're awfully close to an awful lot of people. And if you test positive, isolate to protect others. You isolate to protect the vulnerable. So my timeline, last slide. US is in the early phase of this. It's about to hit us really hard. And we don't yet have a mechanism to handle this. There isn't one. This is just viruses do this. It's going to the cases will skyrocket, as I said, and then by early to mid-February, case counts will probably have started to peak and start to decline. They clearly will have declined by late February or March. And then things will get back to much more normal, much quicker, because we will have a lot of immunity that's gone through the population. I'll be back sometime between now and then to update you. Thank you.